Well, hello, 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 hello. Good evening, everyone, and welcome to our show. Hope you are having a good or had a good weekend and had a great Monday. Hopefully, you guys didn't hear an echo there. I think I had my soundboard set so the sound was coming here. But anyway, hey, I'm Dr. Wood. I'm Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And here on our channel, we help to educate, we help to empower, and we help to encourage you to take charge of your health and your life and to go to that next level, avoid complications. And today we're talking about a very interesting subject. You saw the screen that came up. Yeah. So you saw that we're talking about diabetic neuropathy. Diabetic neuropathy, very important thing that we'll get into that as we go into the evening. We welcome you to our show. We welcome you to our channel tonight, and we are so excited that you are here. If you are new to the area, go ahead and put new in the comments. Let me see if I can pop my little example up. Put new in the comments so that we know that you're here, so that we can wish you a very there you go. We can welcome you to our show and welcome you to our community. If you do have questions as we go throughout the night, go ahead and put a Q and a colon in front of that question so that we know that that's one that we need to go ahead and drop so that we can all talk about it. Okay, so we're excited that you're here. Go ahead and do those things for me. As you know, we always do a shout out. We do a shout out, and tonight we are doing a shout out. I like to shout out, different stores in our area also, and schools, right? So if you're out there and you have a school, you have an organization that you'd like us to do a shout out, all you got to do is get us a shirt. Today I'm shouting out Academy Sports, the one that's down here in Huntsville on South Park, where I went over there and George helped me out. So George, thank you for all that you do. If you're George's supervisor, he did an excellent job today helping me. So give him a bonus or something, right? So there you go. That's what I say. But just so excited that they were able to do that for us. And I see that it is August 1st. Woohoo! And you guys saw that we've got some new things going on. You saw our new design of the opening, and also the one that I'm showing you right now. Now, August is also a very important month for this show. We are celebrating 2 years. That's right. We're celebrating 2 years for this channel, the anniversary of this channel. And it's just a year ago that we went live with our show. Prior to that, if you remember, and if you go back, you'll see that we were doing pre-recorded videos, and we've done some over the past year as well. But for the most part, we have used this live show as our platform for all the things that we have done. And so we're going to be celebrating on the 4th. So come on back, right? We're going to have a special night, and we're doing something special for the month of August. I'm not going to tell you about that right now. Come back on Thursday. On the 4th. And you'll see that. You will see me coming on tomorrow again, and the day after that, and the day after that. So just to kind of hint, so in the month of August, we're going to be doing something special. But so thank you right now for all of you who have had a part to play in what we are doing. All right, let's see. I think I saw somebody new. Let's see, who do we have here? We've got Pastor Parker. Hey, Pastor, thanks for stopping by and hanging out with us. Let me go ahead and give you a little. Pastor Parker is new with us, and we are so glad that you are here. Thank you for stopping by. And tonight we are talking about a very important subject, like I keep saying. You guys know, and you'll see it scrolling down the bottom there, that there are almost 500 million people on the planet, 1/2 billion people on the planet that have diabetes. That is a huge number. And in our country, in the United States alone, there are 37 million people who have diabetes, and over 90 million people who have pre-diabetes. So if we put them all together, we're talking over 100 million people that have diabetes or pre-diabetes. And one of the important things that we're going to mention tonight is that even if you have pre-diabetes, you can still develop neuropathy, right? So everybody thinks, oh, it's only a diabetic thing, but we're going to learn here in a little bit that there are a lot of other things that can cause it, and that pre-diabetes predisposes someone to diabetes or to neuropathy as well. So why don't we go ahead and let's just jump right into it. Let's see if we got our little. Let's see if we have our. There you go. All right, look at that. All these new graphics that we're pulling up here tonight. So the question is, what is a nerve, right? Because we got to talk about what a nerve is before we can get into neuropathy. So a nerve is simply some tissue that takes signals, right? They take signals from your brain to other parts of the body, or from the other parts of the body to your brain. And as you saw there are three main things that they do, right? They tell the brain how things feel. So you're walking around and you're touching things. Is it soft? Is it hard? Is it prickly, right? If you touch the thorns on a rose, what does that feel like? Is it velvety? So all those sensations, all those feelings are carried by nerves. They also carry some other sensations, such as cold and hot, right? So that's some interesting ones. And those are just sending signals to the brain so that most of the time you should be able to close your eyes and touch something and you can describe it to me. You can tell me what that thing feels like. Okay. The other thing they do is they help us move, right? So that's a huge part of what we do as human beings, right? Whether we are work, right? Whether we are playing basketball, football, whether you are just hanging out, right? And there are parts of the body that we don't necessarily move on our own. So they are moving automatically, and it tells us how to, or those nerves help your body to move those organs. So how does your heart beat? When you eat, you're not thinking about digesting stuff, right? So, but those are things that are happening automatically, and those things are happening because the nerves are doing what they are supposed to do. So the question then, so we're talking about diabetic neuropathy. So what is neuropathy, right? So neuropathy simply means damage to the nerve. That's all it means, damage to the nerve. And, there are several things that can cause neuropathy. Several things that can cause neuropathy. Now, most people think that diabetes is the only thing that can cause neuropathy. But as you see there, it is the major thing that causes it, but there are so many other things that can cause neuropathy as well. So we've got, cancer that can cause neuropathy. We've got vitamin deficiencies. We got autoimmune diseases. There can be genetic things or components in your body that can cause neuropathy. You can have medications that are causing neuropathy. Sometimes if someone becomes severely ill, right, they're in the ICU, they become septic without the medication doing anything, and without them having a genetic predisposition, just the damage that happens to nerves while they are sick, right? Because remember, the body is ill and it's fighting, right, sometimes to stay alive. And so all of those things can cause neuropathy as well. Some vitamin deficiencies, right, can cause it, like B1, B12. We can have vitamin excess, so B6. If you've got too much B6, that can cause neuropathy as well. Some medications that are used to treat cancers, right? We said that cancer can cause it, but some of the medications that we use to treat the cancer can also cause it. Because remember what medications do, or cancer medications in this sense, or even some antibiotics, right? So they're trying to kill the offender, right? Whether it's a cell that's replicating in an infection or in a cancer. And by virtue of how they work, they're killing cells. And some of the cells that sometimes that can become damaged are the cells in the nervous system. And if that happens, then we develop neuropathy. Because remember, neuropathy simply means damage to a nerve. Okay? We're tonight going to be talking about the major one that causes neuropathy, but there are other things that can cause neuropathy as well, as you see there. Okay, so what really is going on, right? What causes diabetic neuropathy? Well, diabetic neuropathy occurs when high blood sugars cause damage to cells. High blood sugars cause damage to cells. And I kind of tell people there are several ways that this can happen, right? And we've talked here before that when blood sugars are high, that sometimes the body tries to process it and it creates these other compounds, right? In the process, these alternate pathways of trying to get rid of the sugar. Some of those substances that it makes can damage cells. If the blood sugars are high, right, and they're not controlled, then there's inflammation that happens, right? Just like the high blood sugars causes inflammation that damages vessels, the same thing happens for our tissues, for our nervous tissue. And so those cells now become damaged because of high blood sugar, whether it's an alternate pathway, whether it's inflammation that's causing it, right? And we've often said, and we pop up to this screen, we've often said that we think about the triopathy. And the triopathy, if you remember, is nephropathy, so kidney problems, retinopathy, so eye problems, which we did a show about a couple weeks ago, and then neuropathy, which is nerves. But every cell in your body, if you're diabetic, is bathed in the same tissue, right, or same substance, right? So there's high blood sugars. So while we know that these cells are damaged and, you know, they become a problem, and everybody talks about these three tissues, every cell in the body can have a problem. You know, a couple of weeks ago, we talked about the low energy state, right? So that whenever there's a problem in the body, then cells begin to die because the body's trying to conserve. So low energy state. So think about diabetes as a low energy state. And actually it's the ultimate low energy state because you have sugar, which is the energy for the body, but the sugar can't get into the cells. And if it can't get into the cells think they're starving. And if they think they're starving, what begins happening? Yeah, the cells begin to die. Okay, so remember that it is a low energy state. So let's pop back over here, and so that's what happens, right? So we have high blood sugars. The blood sugar causes problems, and as a consequence of high blood sugar, sometimes we have high cholesterol or high lipids, in particular triglycerides, and then those triglycerides can also cause damage to the tissues. If they cause damage, they can cause damage also to blood vessels. And if those blood vessels now are not bringing the oxygenated blood, and so the oxygen now is low, then we begin having problems in further death because the body doesn't have the oxygen, or those tissues don't have the oxygen that they need. Okay. Now there are four different types of neuropathy. That we're going to talk about as it relates to diabetes. Okay. So there's peripheral neuropathy, which is where, and this is the one that most people think of when they think of neuropathy. And this neuropathy is where remember the nerves, they come from the brain, and and I won't go through the whole pathway, but they end up in the different tissues. For instance, they end up at your fingertips, they end up at your toes. And so peripheral neuropathy means that the nerves and those distant places, right? So fingertips, farther away from the body, and toes, then those begin having damage. And these are the small nerves within those areas. Okay, so peripheral neuropathy. And we'll see a little bit here in a minute, some more about peripheral neuropathy. The other one is autonomic neuropathy. Remember, I told you that all the tissues in the body are bathed in the same milieu, if you will, the same blood sugars. The same blood sugar that's touching your toe is the same blood sugar that's touching your heart, that's touching your liver and your kidneys and so forth. And just like you can have damage to the nerves that go to the periphery or the toes and the hands, you can have damage to nerves that go to the organs. So autonomic neuropathy is where there is damage to these organs that causes other problems. So one example of this, and we'll come back to talk about peripheral neuropathy, but I think one example of autonomic is where your body is not able to regulate your blood pressure, right? Because the nerves to the vessels are damaged, or the nerves to the heart are damaged. So that you stand up, and when you stand up, what happens? The blood pools to your feet. When it pools to your feet, what's supposed to happen is the vessels are supposed to contract and send blood back to the heart. And then the heart is supposed to increase its contractility, and that is how hard it contracts, and the rate, how fast it contracts, to keep your blood pressure going up. Well, if the nerves are damaged, then the heart doesn't get that signal right away. And so you stand up and you begin feeling lightheaded or dizzy before the body's able to compensate. Right now, in the early phases, the body's able to compensate because, it's not that far gone. But in later phases, you stand up and, it takes a little bit for the body to catch up and say, oh, he just got up. The blood's pooling. Okay, I got to contract the vessels. Okay, now I got to get the heart to beat faster, and I got to get the heart to beat stronger, right? So all those signals that are supposed to happen automatically, they don't happen. And so you can have issues there. The other one is proximal. So proximal has to do with the hip muscles, the thigh muscles, and the buttock muscles, right? So that you begin getting weakness in those muscles. And those are the main muscles that help with your core, okay? So they help with balance. So when you're walking, right, there are a lot of things that are going on that you don't even realize, that your body is shifting, right? Because walking, the act of walking is almost like you're falling, right? That's really what it is. It's an awkward thing, but we are actually falling forward. But our body keeps us balanced because we are able to kind of rotate and pivot and turn. And so we don't fall over. But if those muscles are not getting the right signals, that's the hip muscle, the thigh muscle, the muscle, the gluteus, and so forth. If those muscles are not getting the right signal, or they become weak for some reason, diabetes, then you can see that can become an issue. And then the final one is focal. And focal is where there is a particular place where those nerves are damaged. And one of the most common focal neuropathies in diabetes is actually carpal tunnel. While most people don't feel the full symptoms of carpal tunnel, a lot of people who have diabetes do have some carpal tunnel. And it may not be diagnosed, but they do have some problems. So those are focal. And so those are the three different types of neuropathies. Now, you could see that as we talk about peripheral neuropathy, there are people that are out there that they may not know. If you're watching right now, you may not know that you have neuropathy, right? Because it's not what you typically think of as neuropathy, right? So because you're thinking numbness, tingling, burning, which we'll get to here in a little bit, okay? All right, so how common, there you go, how common is diabetic neuropathy, right? About 1/2 of the people who have diabetes have peripheral neuropathy, right? So this is the most common one. Over 30% of diabetics have autonomic. So that's the one where the organs are affected, okay? And the most common focal, like I mentioned earlier, is carpal tunnel syndrome. And although less than 10% of people with diabetes feel symptoms, we think that about 25% of people who have diabetes do have carpal tunnel neuropathy or carpal tunnel syndrome. And then the proximal neuropathy, which is the thigh muscles, the hip muscles, and the buttock muscles, that one is less common than the others. Okay, less common than the others. So, yeah. So what are the symptoms? What are the symptoms? Now, let's take a moment, and I'm going to talk about probably the most common three, right? Numbness, tingling, burning. That's what everybody says. Numbness, tingling, burning. And so let's walk through this for a minute. And let's talk about numbness. What does numbness mean to people? Well, numbness to some people can mean, that feeling that you get when like your arm or your leg goes to sleep, and it's uncomfortable, right? So it feels, sometimes it feels almost like it's burning, right? And you're like, oh man, come on, but it's uncomfortable. So some people feel that as numbness. Some people feel nothing, like they can't tell. You touch their foot, you touch their fingers, and they can't tell that you've touched them. Or some people just can't tell where their foot or their arm or their fingers are in space, right? So one of the things that happens in our body because of our nervous system, because of the nerves, is you can close your eyes and you can pretty much tell, right, where something is. Particularly if you've done something over and over. For instance, you get up at night, right, and you're moving from your bedroom to the bathroom because you go into the bathroom, and you get to the bathroom door and the door is closed and it's dark, and you can almost put your hand out and open that door, right? Because your mind knows where it should be, and you could tell where your hands are in relation to where the doorknob is. So some people can't have that. They can't tell that. So they close their eyes, or it's dark, and they can't do the things that they normally do, right? So that numbness. Tingling is probably more closely related or described as that sensation that you get when your foot is asleep. It's almost like it's tingly, right? Or I don't know. I was going to say sunburn, but that's kind of painful. Yeah, that's an interesting. Oh, here's one. So let's say you go outside and it's cold. Yeah, that's a good one. And you come inside, and at first you can't tell, right? Because your fingers are cold. And as they begin to warm up, before they become painful, that sensation that you get that's between when it's really, really cold or when you start to maybe feel a little pain, right? Because it's now warming up all the way, that in between is kind of tingly, right? So numbness, tingling, and then burning is kind of like, I say burning, right? Yeah, so it feels like almost like your feet are on fire. One of the things that sometimes people will say in terms of the symptom is that they feel almost like they got a shock. And if you're out there, right, if you felt that, go ahead and drop that in the comments. Say, yeah, right? Say that, yeah, I know that. So it's almost like somebody took, I don't want to say cattle prod because it may be that, but they shocked you. And just for that moment, right, it felt like that. Now, there are some people whose neuropathy comes and goes. So you get these sporadic charges, tingling, burning, and it goes away. But some people, particularly if they've had long-standing neuropathy and it's progressed, then it's burning or tingling or numb all the time, right? And so that can certainly cause some disability. And so you can see there, so it can cause problems, numbness, tingling, burning, pain, weakness, as we mentioned before. Those are those proximal muscles that sometimes we'll see. Loss of balance because those core muscles are not working well, or that you don't have a sense of where you are in space, okay? Peripheral neuropathy or neuropathy tends to be worse at night for some people, right? For a lot of people. During the way that they're busy, and when they lay down, getting ready to go to sleep, they're more focused and they can feel more, right? It probably was there all the time, but it's just now worsened, right? Or not worsened, but they're now noticing it. So worse at night. Another one that I don't have here on the screen is that for some people, peripheral neuropathy worsens when it's cold. So during the winter time, they really, really can tell, oh my goodness, yeah, this is crazy, right? I had one guy that has neuropathy, and he was telling me that he was driving, and that split second pain came, and he said all he could do was just hold on to the steering wheel, right, and and keep his foot on the brake, right? Because for that split second, right, it was bad. And then he pulled over and, just took a moment to catch his breath and so forth. But like I said, some people it comes and goes, but some people it is there all the time. And then of course, problem sensing temperature, right? Now this is a big one for diabetics, particularly if you live in a cold environment and you're using space heaters, right? Now space heaters themselves, there's a whole nother conversation we can have. But what happens is sometimes people can't tell the sensation of heat, right? So their feet are cold and they lay in bed and they put the space heater like at their feet and they fall asleep. And because they can't sense temperature or cold, they don't feel that the space heater is now causing damage to their feet or their feet is burning. And so they wake up and they've got a blister. They've got something that's going on. Okay. Sorry, I thought I heard somebody knocking. So pain, temperature sensation, that's an important one. So what are the problems? There are some significant things that can happen. One is because people can't tell the sensation, right? So they wear tight shoes, for example. And normally, if your shoes are tight, you can tell, oh my gosh, it's tight on this part or that part. But they can't, and you take it off or you change shoe or do something. Even if you wear that shoe, you stop, you take it off, you rest for a minute, and then you put it back on. Okay, like I've seen that happen a lot of times, particularly when you go to church, you see women take off their shoes, right? They got slippers that they were walking with, and that might be for some other reasons. But that same thing happens, women and men, because they can't feel, they don't know that those shoes are a little too tight. And so what happens is that burning, that rubbing begins to cause a blister. And if they can't tell that there's a blister, then that blister pops, and it's already difficult for people with diabetes to heal quickly. And so that blister now festers, it gets infected, and that leads to all kinds of other problems, right? So you see a foot ulcer. The other thing that can happen is that the bones in the feet can become damaged. So I want you to imagine walking, right? I want you to imagine walking. When you're walking, have you ever walked and stepped wrong, right? And you felt an immediate either pain or you felt your foot go down and you immediately stopped or picked the foot up. That is the process the body has to prevent damage. So you can imagine now if you're walking and you put your foot down wrong and you can't sense the pain or the awkwardness of where you put your foot, then what happens is that you don't pick your foot up. And you now, because if that's the foot that's going down, you now put all of your body pressure on the foot in that position. And when you do that if you do that repeatedly, or even in that instance, now we've got bones that are involved and the bones become broken, the foot becomes deformed. And one of the complications that we have is something called Charcot or Charcot's foot. You can see Charcot's joint and those types of things. And that is because the bones, we have problems with the bones, and then the feet become deformed. The feet becomes deformed. You see that the top picture that may be on your screen right there. Okay. And then the bottom one, of course, is the ulcer that we talked about. Now, and we'll come and talk about that and how we can help to prevent some of that. Okay. All right. So how do we prevent diabetic neuropathy? How do we prevent diabetic neuropathy? Well, we're going to come back to that. Right now, let me say, if you've not already done so, please go ahead and subscribe to our channel. Go ahead and let us know that you're here. If you have a family member who has diabetes, who has neuropathy, or you want to help them prevent neuropathy, this would be a great show for them to watch, because it is one of those core things in diabetes, right? Core things in diabetes. How do we diabetic neuropathy and so forth. Last week, if you remember, we did endocrine eye disease, and in endocrine eye disease, we did diabetic retinopathy. So that's another one to go through. And as we go through with the channel, remember, one of our points is to educate. And so over the course of time, you'll be able to go back and say, okay, what are the diabetic topics, right? And you can pull out the retinopathy, you can pull out the neuropathy. We had Dr. Walker on, and we talked about kidney disease, right? So nephropathy. We had how to prevent diabetes, how to treat diabetes when you're sick, right? So all of those diabetic related topics, you can go out there and you can find them on the channel and watch those, and you can either send them to someone or watch them yourself. Okay, but let us know. And if you are here, whether you're here now or you're here in the future, watching this on the replay, if you would, in the comments, I want you to put a hashtag Dwayne Wood MD, and I'm popping it there. Hashtag Dwayne Wood MD. Okay, and then if you're watching this on the replay, go ahead and put hashtag replay so that we know you're here. If you have questions during that time, we'd love to answer those as well. And this is a great place for us to do our thought of the day. All right, thought of the day. Now, I'm going to take this thought from a message that I gave this past weekend. This past weekend, I talked about being in the middle, right? So what do I mean by in the middle? So we have, for instance, you're in a race, right? You have the start, you're lining up. We have the middle, you're running, and we have the end, passing the goal line, or getting a trophy, getting a plaque, getting a ribbon, right? So that's the thing. So starting, the middle, and the end, right? Also, we see that phrase or that sequence in lots of other things that we do. For example, you go to school, right? You start, right? You pick a major. And then there's the middle where you study and you take classes and you take tests. And then there's the end. You get that degree. We see it in marriage, right? You're standing there on the wedding day and you say, I do. That's the start. And then there are all the years of stuff, right? The kids and the house and the pregnancy and the cars and the so on and so on, the careers, right? So there's all that. And then one day somebody says, hey, wow, you've been married 50 years. Okay, so start, the middle, and I don't want to say 50 years is the end, but you get the drift. And it is in the middle part. It is in the middle part where we do most of our living. Do you realize that? Oh yeah, I mean, we love to start. Yeah, everybody's excited. Wedding day, you're picking out the tuxedo, you're picking out the dress, you're picking out the honeymoon location, you're picking out all the people that are going to be in the wedding with you, you're picking out the food and the venue and all that stuff, right? Oh my God, this is exciting. Right, and then you get the golden anniversary or the bronze anniversary or whatever anniversary it is, right? Exciting down the road. But from the time you show back up home, for that, after the wedding, guess what? You got to get up every day. You got to wash the dishes. You got to iron the clothes. You got to put out the trash. You've got to sweep the house. Well, not sweep. See, I said that. I'll tell you how old I am. But you got to clean the house, right? You got to get the little vacuum cleaner. Or if you got one of those Roomba things, you put it out, right? So all those things are happening. And that person that you stood up with that day, right, in that white dress and in that tuxedo, they don't look like that all the time. And you got to see them every day, right? You got to see them for real, for real. That's where the rubber, as they say, meets the road. And we've had all kinds of different things that we've talked about. We've talked about I'm between a rock and a hard place, right? My life is tight right now. I'm in a jam. I'm in a pickle. I'm in a box. I'm for myself in a corner, right? So all these things, and all those things are because we are living in the middle. And the question is, what do we do in the middle? What do we do in the middle? And in the middle, there are some things that we've got to make sure that we're doing, right? So number one, we've got to make sure that we are learning. Oh my goodness. Can you imagine being in the middle for 50 years in a career, in a job, in a marriage, at school, right? Raising kids for 50 years and not learning anything. And just whatever you knew 50 years ago, that's all you know right now. Wow. No. You got to be learning whatever it is, right? You've got to be learning something. Even if you learn one thing a year, at the end of 50 years, you got 50 things you can look back on, right? Because the point of it is that when you get to the end, when you get the degree, when you get the 50 year of marriage, when you get to the, you started out as a lower level person in the company, and now you've met middle management or even executive, right? When you get there, the stuff that you need to know are the things that you've been learning, right? The person that you are, right? They're going to teach you some skills once you get there, but what you're bringing to where you end up is going to be the stuff that you've learned. And so you got to be learning. Number two, you got to be patient. Oh yeah, you got to be patient. Yeah. Right? So it doesn't happen overnight. I wish it did. I'll tell you that. Like when I was going through medical school, I sure enough wish that they could just open my head and just pour the information in it and be done. Right? That means I wouldn't have to get up at 3:00 in the morning. I wouldn't have to stay up for 36 hours. Right? I wouldn't have to go down to the ER over and over and over during RSV season at Dayton Children's, or all those patients that came in that were having chest pain and so forth, right? If they had just opened my head and poured all the information in, boom, I'd be like Doogie Howser, just bam, right? But it took time. And we've got to learn patience. It is a process. The process is what makes us who we are. And number three, and you've heard me say this for almost everything that I've talked about, you've got to surround yourself with people that will help support you and push you along. You can't have people around you that are pulling you down, people who are negative, people every time you want to do something like, oh, that's not going to work. You got to have people around you that's going to say, hey, everybody else doesn't believe, but I believe in you. I believe in you. I believe in this vision that you have. And you got to have that. Surround yourself with those people. So while you're in the middle, ooh, yeah, you're learning. You realize that there's patience. And you've got to have people around you that's going to support you. And that's our thought for today. All right. So let me just do a plug right here. So there are some things that we've done recently, and we're going to tell you as we go through this next part of our show into the seasons, really, right? So we're starting a new season now in August. And so there are things that you're going to hear about that we're going to let you know. So recently I I preached a sermon in Birmingham at Birmingham Ephesus Church. So you can go out to Ephesus SDA down in Birmingham. You can see that there. We did a podcast interview with Stephanie, who's one of up and coming media people here in town. We're going to put that link on the show notes, right? So I want you guys to go out and support her, support me. Of course, we had Dr. O on a couple weeks ago as we helped to build help him grow his channel. So here, right, this is a community that we're building, and our community is going to be reaching out, right? So all these things that you'll see on social media and so forth are things that I want you guys to kind of go out and please support Stephanie on her YouTube channel. Like I said, I'll put that in our show notes so that you can get over there and listen to me as I interview with her, but also look at some of the other things that she's doing. Listen to me as I spoke at Ephesus, but also look at what they've been doing and some of the great things that they are doing down there. We've got another podcast that we did recently, and I'll let you guys know when that's going to come up so that you can take a look at that as well. And then, of course, here on the channel, go ahead and hit a subscribe. If you've not already done so, give us a thumbs up on this video. Watch some of the other videos and let us know so that we can engage with you. All right, so we are back with our peripheral neuropathy. So how do we prevent it? All right, how do we prevent it? So. And you'll see some of these same things, right? And let me say this, right, before I get into this. A lot of what we do in medicine, right, a lot of the preventative things are exactly the same. We don't invent something new for every disease process. Particularly as we talk about, and let me bundle some things here with you here for a minute. Particularly as we talk about metabolic syndrome, as we talk about obesity, as we talk about diabetes and prediabetes and PCOS, right, and high cholesterol and high blood pressure, right. So all of those things, if you look at the treatment for them, they are exactly the same. I mean, there's some tweaks here and there, right, but you'll see a theme through all the things that we talk about, right? And as one of the guys, well, I'll tell you that here in a minute. All right. So how do we do that? Right. So we manage our blood sugars, manage our diabetes. Number one, if we're going to prevent progression to peripheral neuropathy, and diabetes is the major cause of peripheral neuropathy, then we manage the diabetes. But managing the diabetes means managing all the things that are related to diabetes, right? Like what? Well, blood pressure, cholesterol, obesity, sedentary lifestyle, all of PCOS, metabolic syndrome. So managing all of those things helps to manage diabetes, and managing diabetes helps to prevent peripheral neuropathy, right? So huge. So make sure that you talk with your provider. Well, how do we keep our diabetes under control? I mean, that's a whole nother conversation, right? So we'll come back and we've done a couple of shows on that, but we'll come back and add more to it. Right. But make sure that you are managing your blood sugars. Make sure you're managing your blood sugars. Right. So be physically active. Right. So exercise helps neuropathy. It helps it for lots of different reasons. One of the big reasons is that it helps to provide blood flow to the area. Remember, one of the problems we have with diabetics is that they're not having enough blood flow. The blood sugars are damaging the vessels, but we're also having decreased blood flow, so decreased oxygen, and so that causes problems as well. Okay, follow your diabetes meal plan, right? So eat well, right? So nutrition, all of those things. Make sure that you're limiting alcohol intake and smoking, right? Huge. In fact, one of the guys that trained me down at UAB, when he walked in, he said, hey guys, everything I'm about to tell you right now, if you get people to stop smoking, it improves it all. This was as we were talking about pathology. So pathology is the study of disease processes. So he's telling us we're about to talk about a bunch of diseases, but if you get somebody to stop smoking, everything we're about to tell you improves. Huge, right? So that one thing. And then of course, take your diabetes medications as your doctor has prescribed. Talk with them. If you're having issues, let me say this, right? And I said this during one of the podcasts when I was interviewing. I have no problem with somebody saying to me, hey, Dr. Wood, this medicine, this whatever, this treatment, I don't think, right, this is the right thing for me. I got no problem with that. We could talk about it, right? But if we've decided on the treatment, you go away and, you hear, Joe on the street telling you something about what we've decided, and you come back 3 months later, the blood sugars are out of control, and you tell me, well, I decided I wasn't going to do that. I got a problem with that. Okay? Call the office. Let us know. Say, hey, what can we do? We'll bring you back in, right? I'm good for that. You ask my patients. I say, come in, and we'll sit and we'll talk. They're like, can we do it over the phone? No. Right? We're talking about your life. Take a moment, right? Take some time, come to the office so we could sit down and so we can talk about what do we need to do to save your life, right? Huge. So follow the treatment plan and talk to your doctor. If there's something in there that doesn't fit you, that's okay, right? And most doctors, we're not, most of us, we're not going to fuss that much, right? Right? We'll talk with you about it. All right. So how do we prevent diabetic neuropathy from getting worse? What do you think? Eat well, control diabetes, control blood sugars, control, right? It's the same thing, guys. And then a big one here that I want to add is to make sure that you're getting good foot exams and make sure that you are checking your feet, right? So let's talk a little bit about that. Now, as I talk about that, I'm going to put my slippers back on, right? Because they're right here under my table. My floor is carpeted, right? So don't walk around barefoot. I'm going to pause right there. Okay. My son has Legos, and I think the Legos, they multiply, right? So they're all over the place. So I can't tell you the number of times, right, that I've gotten up, right, and I didn't get my slippers, right? Just like I did right now. So if I got up and started walking, it's possible that there's a Lego somewhere. And if I don't have good sensation, if I have neuropathy, then that Lego, because I'm coming down hard, right? I'm not like tippy-toeing. I'm walking, particularly if it's nighttime. And if you're not careful, there can be little things in the house, even in the carpet, that you don't know that's there. And so now, boom, you step on it and it creates a little break in the skin or it goes into the skin. And if it goes into the skin, if you're not paying attention, and we'll talk about that here in a minute, then you can have a problem. Okay, so that's number one. Make sure you're not walking around barefoot. Number two, look at your feet. Look at this for everybody, but for my guys, for my gentlemen, for my men, come on. Right? I know what we do, right? We get out of the shower and, we put on some deodorant and we put on some clothes. Right? We don't look at the feet, but I need you guys, I need women as well. I need you to take a look at your feet every day, right? Make sure you're looking at them. Look between the toes, right? When you get out of the shower, dry your feet. Make sure you put lotion on them, right? A good moisturizer. All right. I tell people Aquaphor and Eucerin, put them together. Get in the shower. After you come out of the shower or the bath, dry your feet, look between the toes, make sure you dry them off, and then take some Aquaphor, take some Eucerin, rub them together, and put them on the feet. So the Eucerin will moisturize the feet. The Aquaphor will seal it in. Now I have got no stock in either of those, but I find that works a lot for our patients. Okay. All right. So I don't want you to come to the office with your feet all crusty and broken, and right? That's not what we want, because that itself leads to the potential for damage, right? For infection, right? Make sure you're doing that. When you cut your toes, don't do like this one guy was I in Dayton at the time? I think so. Right? Comes in, right? And he cuts his and the toes look great, right? The toenails, sorry. They look great. And I complimented. I said, hey, this is great. How'd you do that? He said, I used a pocket knife. No. Right? Don't do that. Go to the podiatrist. They will clip your toes. Get someone in your house, right? That's knowledgeable, that can see, and cut the toes. And as you do it, you want to cut them straight across. Right? Sometimes we try to make them curved so they look all nice. No, cut them straight across and then use a file, right, for the edges so that, get them to where you want them to how do you want them to look, right? For my diabetics, a lot of you like to get pedicures and manicures. Take your own equipment with you. Yep, you have to invest, right? Take your own stuff with you. And the reason for that is, remember, as you're getting a pedicure or manicure, they're getting into the cuticles and they're getting under the nails, right? And I'm sure that sometimes you've been there, you've had something happen and you saw some blood, right? Because they went a little deep, too deep, or you felt a little pain, right? That little deep, that little blood, that little pain that you saw, that you felt, right, is potential for infection, right? So take your own things. Okay. And then I always said about, looking at your feet and making sure that your feet are the way they should be. Okay. You should get a podiatrist. You should get an exam once a year. I send my patients, I tell them, they say, hey, I hand them the paper. Say, here's the podiatrist. Go tell them you're diabetic. I need a foot exam. Right. They'll probably see you more frequently. If you need specific or shoes, they can do that as well. Because remember, there's sometimes, because there is neuropathy, we don't shift our weight like we should. And so they can give you special shoes to help modulate that or help turn your feet in a certain direction so that you don't run into problems. Okay. So how do we prevent it? Awesome. So how do we treat peripheral neuropathy, right? And so here I am going to go through the current medical treatment. There are some other things, and we may come back and do another show of alternative things that we can do. But remember, one of the big things we talk about here is inflammation, right? So you can keep that in mind. So as we're talking about this, you can think of things that can decrease inflammation, and those things can help with neuropathy as well. But we tend to use a lot of antidepressants, anticonvulsants. So things like amitriptyline, nortriptyline. Some of you out there are on gabapentin or Lyrica or Cymbalta, right? Any of those things can help. And the key here is that not everything works for everybody. Not everything works for everybody, right? So they may have to try a few things before they get to whatever is going to work for you. The other thing is exercise. We talked about that just a little bit ago. Exercise will help with neuropathy. Now, it gets into this circle though, right? The cycle, because people say, well, I want to exercise, but I can't because I'm in pain. But if you don't exercise, then the pain doesn't improve, right? So I'm not saying that you've got to, be in 10 plus pain if you're on a scale of 1 to 10, but you have to do something. Or have to do something. People say, I can't walk. I say, well, you can use the upper body. Right? There are muscles in those arms. You remember that? Yeah, those are muscles. Right? So exercising. Now, there are some things that you can do while you're sitting. Okay? And talk to your doctor about some foot exercises that you can do at home that can help with neuropathy. Right? Once again, like I said, we'll probably come back and do a show on medicine treatment for neuropathy. There are some things that have been used that seem to work, that do work, patients that we've sent to different places. And I'm not going to speak for him, but I'm going to try to get on the show who does some neuropathy work. Okay. All right. So I think that's it, guys. Neuropathy is a huge problem. It's probably the most common complication of diabetes. More than kidney disease and more than retinopathy, right? Neuropathy is probably the most common. And managing blood sugars, getting exercise, managing high blood pressure, managing cholesterol, making sure that we're looking at our feet and taking care of our feet. So, so, so important. I love it. Well, I thank you guys for being here. Once again, if you've not already done so, go ahead and give a thumbs up for this show. for this episode. Come back, right? Throughout the week, throughout the month, we're going to have some stuff that's going to be popping up, right? So make sure you subscribe, you turn on that bell so that you can get notification when that's going to happen. And then go ahead and drop us a line. Remember, hashtag Dr. Dwayne Wood MD, hashtag Dwayne Wood MD. If you're watching this on the replay, go ahead and put hashtag replay in there, and we'll go from there. Once again, this is Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. Glad that you are here. We are educating, we are empowering, and we are encouraging people to take charge of their life, take charge of their health, avoid complications, and go to the next level, right? We'll see you at the next video. Awesome.